All right. So this part of the class, um, I want to share a variety of projects, and I've got three different videos to share. And some of them will watch the whole thing, other ones will just watch, a few minutes of it. But each video was completely different. They went about it in a different way. Each paper was constructed in a different way, presented in a different way, but they were all great. So you can go about these projects in different ways, and they're all good. So I just wanted to share some of the different styles and talk about, what I thought was done well and maybe done very differently. And one video is 15 minutes, one video is 40 minutes. They're all different lengths, but they covered what needed to be covered. And I thought this would give everybody a good example. And so let's say you watch some of these and you're like, oh, I wish I had done that for psychological first aid. Go ahead and change it and upload it again. I don't care. I'm not grading them yet. I will probably start them, probably Sunday. I work at the hospital Saturday, so I'll probably start grading them Sunday. So yeah, if you want to change anything, go ahead. Um, all right, so let's see what we got. Okay. So don't worry, everybody got the same score. So I'm not sharing anybody's grade. If you do the work, everybody gets full credit. So, everybody gets an A, everybody gets 40 points. You all get the same grade. Um, so let's see. All right, so um this is pretty straightforward. So you got the title page. It doesn't have to have like the APA heading, but it does have to have basically what the project was, who wrote it, and the class. You know, something basic in the title page. And then they basically just followed along with the headings in the assignment. And they wrote this in narrative style. And so narrative style is paragraph. And they just had the main headings for the paper, then they had references at the end. So that's pretty straightforward. And I thought this was the reason I'm sharing this. It's almost exactly 15 minutes. That was the minimum. But they covered everything in 15 minutes that you needed to cover. So we're just going to watch this 15 minutes. And yeah, they could have included whatever, but they hit what needed to be hit. So yeah, this is just a nice 15-minute example. So it's kind of like they fulfilled the requirements, they did a good job. This is what's expected, and uh, and then we'll show some other ways to go about it.
Calgaris. And my name's Amanda Miller. Oh, go ahead, Amanda. Today we're gonna be talking about Simone Baker, who is presenting to a pediatric clinic, and we're gonna talk about ACEs and how that relates to Simone and what the recovery process looks like with identifying ACEs and we go from there. So we took a bit of time and really examined this case. So we wanted to give just a brief synopsis of Simone. Liana, do you want to give an overview of what she's presenting with.
Sure. So Simone is a 20-year-old mother. She came into the clinic because she felt that she was struggling with some PPD or postpartum depression. And so she came in.
So a lot of you did mention postpartum depression, some of you didn't. But that's probably what we're looking at, postpartum depression combined with early trauma and current socioeconomic and other living stressors during the present.
In with her 4-month-old daughter, Amber. Her daughter is thriving. Her daughter is not concerned, but Simone herself seems to be struggling. She reported overwhelming feelings of sadness. She was struggling to get out of bed. She had severe weight loss and very poor appetite. And was just overall exhausted and seeking serious help following the birth of her daughter. So when she came in, an ACE test was administered, and her score was gathered. Amanda, if you want to talk more about that.
Yeah, so she gave us her history, which kind of prompted the ACE score, and Leanna and I determined we would give her a 9 out of 10 ACE score, just based on some of the things that she disclosed. So, for instance, there was emotional abuse as a child, there was physical abuse as a child, physical neglect from her caregivers, parental separation from her father. She witnessed domestic violence that was pretty extreme. And there was some household substance abuse. On top of all of that, there's some household mental illness, with her mom requiring hospitalization at least twice. Her father had been incarcerated off and on throughout her life. And during the times when her mom was hospitalized, she and her siblings had been placed in foster care. So that's quite a few red flags that we noticed just based off the history that Simone presented with. Is there any details that you think are important to point out, Leanna?
Yeah, so with all of this, it is really important to understand that with a high ACE score like this, it can create what's considered chronic stress or toxic stress. And it can keep somebody stuck in a fight, flight, or freeze mode. They're never really able to fully relax or give their nervous system a break. And that has a very serious effect on the body and the brain, and on development as well. So this could have been something that was passed down to her. And this could be something that she could potentially pass down to her daughter as well. We go to refer to the pennies in the bank metaphor in the Little Book of Aces.
Okay, so this is one of the things I liked about both the paper and the video. I could tell they really spent some time with the Little Book of Aces. You know, that was your one primary reference. And then you need to kind of talk about it.
That means is just she was already very overdrawn in her well-being in her childhood due to all these traumatic experiences that she witnessed and went through growing up, which led to where we currently are, which is her exhibiting major depression. And like I said previously, with symptoms, she's experiencing severe sadness. She's having trouble getting out of bed, severe weight loss, and trouble eating and other difficulties with functioning.
And kind of touching on that pennies in the bank thing, because I was really into that story when I read through that. I found it really interesting too that the Little Book of Aces described it as like a piggy bank, right? And we all have the ability to really build up our pennies and build up our bank, but there's different things that can happen even before we're born that can leave us coming into the world with an overdrawn account. So like when we look at like epigenetics, which is just super interesting to me, Simone was really at a disadvantage. Like her mom had struggled. There was domestic violence, there was substance use, there was some stressors already in the family when she was born. She has two older siblings. Um, in utero, she was experiencing stress. So some of her pennies were taken away without her even doing anything. She hadn't even like breathed air at this point. And then there were moments in her childhood, right? Like they described in a case study where, you know, she had moments where she was well, she had her sister and her brother who was super supportive. So I was gaining some pennies, but then all the trauma that she just experienced through her mom's mental health and substance use issues and different things going on within her home. It was almost like this like balancing act, kind of like balancing like a checkbook, right? And she wasn't really ever able to get ahead, it seemed like, until she was a little bit older in life when she had to leave the home. That's when it seemed that she started to put pennies into her bank.
Along with that, Amanda touched on her having those good moments and putting pennies in her bank, and having those close relationships with her siblings. It is also pretty impressive and noteworthy that, all things considered, she is being a good mom and that she is seeking help for herself and to help her daughter as well. And that sort of sheds a bit of a light to her resilience, which she did take a resilience survey with a therapist um, to sort of better understand and identify where she was with her resiliency. And it's having connections with her siblings like that, having a good, strong core support system like that can be really helpful. And it's something that's really important to also make note of when we're talking about ACEs and Simone specifically in this case study.
Yeah, I think sometimes that it's really easy to get caught up in the language that seems to be fading out, but like the book kept stressing, and the PowerPoint and the little book stressed this too. And I know Grafton said this in class about asking people what's happened to you instead of what's wrong with you. Because just when, I don't know if you've ever been asked that question, but I have, and it really is like kind of like startling when somebody says what's wrong with you. And it's like, well, I don't know. So it can almost like put a person on the defense. And so we learned like through this exercise and through class, like really instilling that hope and resiliency and building on strengths for somebody who has experienced significant trauma can really mean the world. And it just starts with like simply saying to someone, oh my gosh, like what all has happened to you? Like help me understand how we got here. Like I'm curious. And I know like for me, like if somebody were to say that to me, I think it would put me in a much more receptive space to share. So it's just an easy way to start off that conversation as a counselor.
Lindsay, I agree 100%. The wording, the way we talk, and the mindfulness about how we as counselors carry ourselves and carry out our care with individuals, especially for working in settings like this one, where you're coming into contact often, even if it's not often, but in general, it's important to be mindful of how we speak when we come in contact with people who have gone through trauma. That is something that's very crucial, because using a language that might be more insensitive, like you said, what's wrong with you, rather than what happened to you, what did you go through, it can turn people off from seeking help and seeking care and support that a professional can provide them, and in turn that they can provide to themselves. in the case itself, she sort of realized this as well, it seems like, by becoming a mom and caregiving. She became more aware of how she took care of her kids and became more attentive, and we as counseling professionals can actually take away from this that that's something that we need to do too in order to better ourselves and better our practices in the future.
Yeah, and I think, to Simone's credit, like we had talked about our intervention strategy. To Simone's credit, she decided to seek out help immediately. Like she realized something was off and something wasn't quite right. So I think that speaks a lot to her. But then also like to the people who were in care of her, in trust of her care, we have a responsibility too. So like building that safety net, building trust, building that unconditional positive regard from the gate, using that language that you mentioned, that's open and, unconditional and welcoming and, just making somebody feel safe, because when somebody starts sharing their traumatic history, we want to make that a space where they feel comfortable and okay doing that, because to unpack all of this is likely going to be a process, like with Simone. We also identified in our intervention strategy, starting some medication management, hooking her up with psychiatry, or a physician that can, make some recommendations there. And seeing some energy, improved appetite, mood. And then, like you mentioned, she took that resiliency quiz, test, assessment, and realized that she actually does have some skills already in her back pocket. I really liked, it kind of made me smile when I was reading the case study when I realized that she had a son who she had already been caring for several years. So I'm like, oh, this girl already has skills. Like, I wonder if anyone's pointing these out to her. And I think that's a really incredible thing to point out in the resiliency part, because, while somebody might be feeling postpartum depression symptoms, that can be the pits, but on the other hand, she has all of these wonderful attributes that she's already doing. And I think the resiliency questionnaire is able to help emphasize some of that stuff too.
Yeah, I agree. I think that in the end, ultimately, Simone does, like you said, have a lot of good skills and tools that she can utilize. And in spite of her high A score, it does seem like everything is going to work out just fine for Simone, and that she absolutely did the right thing by seeking help and then acting on the help that she received as well.
Yeah, so I think, continued outpatient therapy, continued vent management, continually assessing for suicide risk and depression relapse, and, just kind of keeping an eye on like her maintenance would be a good idea. But it sounds like she really took a lot of the initiative here, and with some proper trauma-informed care, I think she is on the right path.
I agree. After reading the whole case and everything and discussing this prior to this video that we're making, it did really leave me feeling positive and hopeful for her and her case. And then, going forward outside of this class, working with others after navigating this one, that it seems like things are going to improve drastically for her, and they can for other people too.
Yeah, and I don't know about you, but for like as a prospective counselor, really kind of lifted a lot of weight off of my shoulders, and that, this really does seem like it's a multi-systemic kind of treatment team kind of deal, which takes a lot of pressure off of us, but also it's doable. Even for somebody that has like a high ACE score like Simone, her ability to build on that resiliency and create some recovery efforts seemed in essence pretty simple, with the right mix and training and knowledge of how to approach someone.
I would have to agree 100%.
So that is our conclusion. Thanks for watching, and we'll see you soon.
Yeah, so honestly, you know, it was very conversational, and yet you can tell that to be able to just talk about it like that, to be able to pull out the pennies thing and, to talk about what was said on the class videos, you knew they had done their research and were just able to talk about it and apply it to this case. So it was relaxed and yet really pulled out some specific things from all of the references. And the other thing I liked was that it ended on a positive note. They saw that this client could have success, and they talked about how to get there. So very straightforward, but drawing from a lot of information that was provided, very specific things pulling out of like the ACE's book. And yeah, anybody have anything to say about it before we move on to the next one? Go ahead, Anna.
Credit they gave Simone and emphasis.
Right.
You could tell they were like happy and almost excited themselves that Simone had all these good things and had a lot of like good potential and progress.
Yeah, so
That was cool to like see.
rather than
Yeah.
focusing on like all the negative things in that case study, they were pulling out positive things about Simone. Yeah.
Like, this makes me happy. that-
Exactly. Yeah. Anybody online have anything? All right. All right. So this next one's very different. They went about this discussion a completely different way. And Austin and Barbara, and they have nice like narration voices too. And, but they did the whole thing. Well, I'll just show you what they did. Here you go. Can you all hear okay? Oh, she said no. Let me change something here. It is a little quiet, but it sounds good. Here we go. Let's try this.
Thank you for watching this presentation.
Oops.
Today, Barbara and I will be
Now they
discussing the
can't.
case study of Simone Baker, including a written ACE score, discussion, and application of current research to better understand her case. Simone Baker is a 20-year-old mother of 2 young children, Zaire and Amber. She presents with signs of postpartum depression, including fatigue, flat affect, weight loss, and lack of appetite. Her living situation is stressful. She claims she has limited financial stability, minimal partner support, and no extended family nearby. Simone's childhood history reveals multiple adverse childhood experiences.
Food insecurity, foster care placement, physical and verbal abuse, a father struggling with substance abuse and incarceration, and exposure to domestic violence. Despite these different challenges, Simone demonstrates resilience through the support of her siblings, her commitment to her children, and her current steps toward employment and education. Using the Adverse Childhood Experiences Survey, Simone's score is a 10 out of 15, placing her very well into the high-risk category. She experienced verbal abuse, physical abuse, neglect, parental separation, foster care, exposure to domestic violence, a caregiver with depression, substance abuse in her household, parental incarceration, and she lived in an unsafe neighborhood. The research shows that individuals with ACE scores of 4 or higher face significantly increased risks of mental illness, chronic health problems, and even reduced life expectancy. Simone's current depressive symptoms align with these findings, making trauma-informed care and resilience building important to her long-term health and well-being.
Due to Simone's suffering from inconsistent food stability, an unstable home environment that included multiple stints in foster care, along with verbal and some forms of physical abuse, Simone's
All right. So even though they were reading a lot from the slides, they created this entire slide presentation, walked us through each section, and narrated it in a very professional format, which I think was very different than, I think it was pretty neat, and they went about it in a different way. So you can go about this in all different ways, you know and they had some nice statistics and what research showed and this and that, and it's just a totally different way to go about it, and I think it was unique and well done. Any comments about that?
I like the visual aspect of it.
The visual aspect, yeah. Yeah. And if I was shy and didn't want to show myself, this is perfect. Yeah. All right, we've got one more. And basically, the reason I wanted to show this other one was it's extremely comprehensive, basically. That's the word I can use. So, here they have, this is a nice way to put in the link. You can just put it in your paper. Make sure to hit return after it or it won't turn blue so I can click on it. But, make sure it's not private. It's got to be either unlisted or public. And then you can click on it here in the paper. So they got a little title thing here. And they also applied this to art therapy, which was pretty good. I like that. Um, and it ended up being like over 40 minutes long. There's no length on this, it doesn't matter. You just have to hit the minimum, you know. But they were able to put in a lot of information. So I would say the word on this is comprehensive. And they wrote the paper in a different way. So they did this, the APA page, and then they put the link here. But then they did bullet points. And so I like the bullet points. I like the headings. It was easy to follow along for me as a professor for grading. I think the only thing I would say is that I might want the bullet points to be a little more conversational and narrative, but it was comprehensive. So like just for instance, questions you want to ask the client. They had a long list of questions they wanted to ask. The analysis was in narrative. I would probably do more than list the risks. I would probably talk about the risks. But it's a different format, and I was okay with a mix of bullet points. So I like this. So I like this type of bullet point. So here's the question. The bullet points are in narrative. So that would be like the best of both worlds. Treatment, long list of treatment in narrative. So it is a little different about the way they wrote their paper too. Let's watch a little bit. We won't watch the entire 40 minutes, but we'll see how, just so you get an idea, different people,
So we are here to discuss our client Simone. So we are the therapists that Simone's PCP has referred out to get support with this case. So after reviewing her case write-up from her PCP, what concerns do we have right now?
So there's a lot going on, it seems like. She noted a lack of support at home and outside of the home. And it seems like she might be kind of burnt out. So for me, that like brings up concerns about like a higher chance of accidents happening, and potentially postpartum depression because she seems really tired and had a flat affect when she initially presented.
I completely agree with that. The hypersomnia, and she also noted a loss of appetite, which resulted in 15 pounds of unintended weight loss, which is significant. I think also since she has a personal history of depression back, I believe it was ninth grade that was in the notes. That she had a bout of depression at that point. She also has family history from a mother struggled with depression pretty severely, which resulted in foster care placement for her and her siblings. So that risk of depression, I think, is really pretty major.
Yeah. Also, the fact that her family, they're all living in, a one-bedroom home. That's also, seems like it could be cramped and be a big source of stress, so that's also kind of a concern.
Absolutely.
Yeah.
Yeah. So what questions would we ask to better understand her situation and her current state of mental health?
So there is a lot of information in the referral that we got, but there is also a lot of information kind of like missing. So, some things that I would want to ask is about her relationship with her boyfriend. If there is any potential for abuse or anything like that. Because we know that that can tend to be like a cycle, and we know that her mom had an abusive partner in the past. So, just inferring about that, and then also kind of wondering what her relationship with her sister is like now that they are not living together anymore, because she was cited as like a significant source of support, and it sounds like she's not necessarily around as much anymore. So I would be curious about that dynamic.
Definitely. I know that her mother is in a disability facility at this point because of her health complications, but I would also want to know just what the relationship with her mother is like now. I know that her mother was a strong sense of support with her first child. So I understand that because of her disability at this point with her amputated leg, she would be able to be a physical source of support, but her mother also potentially could be a source of emotional support for her, even from where she is at right now.
Yeah. I would also want to know a little bit more about her finances, because there are a lot of things that indicate that she could be at a low income level right now, with her not working, and it seems like her boyfriend is working quite a lot, but we don't necessarily know what he does, or what the income is like.
That's true. And what kind of hours is he working as well? Is it daytime, nighttime, swing shift? Did it, I don't recall if it listed if he works one or even possibly multiple jobs. I believe the notes just said that he worked
Most of the time.
most of the time. Yeah, that's what it said. So that's understanding exactly what that dynamic is with his work. You mentioned community. I would also want to know what kind of a cultural background we're working with, because there are definitely some different cultural influences I think that could come into play, especially with treatment planning down the line. Because I know that there are some cultures that really strongly rely on like community or even church as a source of support. And if that's culturally appropriate for her, that might be something helpful to lean into.
Yeah, looking ahead a little bit at her childhood resilience survey, it says that she said no for enjoying community traditions. So I wonder if, what's going on with that, if, she just wasn't really, sort of like exposed to those things and wanted to be, or, what's going on with that.
Yeah, that's a great point, because the no on that could be I didn't get the opportunity to be in community traditions, or I was there and did not feel connected to them. And so there's a lot of wiggle room in why that answer is the way that it.
Yeah, so here they're crossing over and making connections. They're not just going straight through. They're like, oh, I could apply the resiliency answer here to the culture question I'm curious about. So there's just a lot of depth and connections.
That's a really good point.
And along with that, I'd be curious about like if she has any spiritual beliefs, things that might kind of like affect her thinking and all of that.
Absolutely.
And then also just based on what we know, I'd be interested in doing a suicide risk assessment. That was something that was mentioned in the little book of ACEs, is that when an adult has presented with I think 6 or more ACE identifiers, that they should definitely get a suicide risk assessment, and
Yeah.
probably also a PTSD assessment. We don't really have enough information to go off of to say whether she meets diagnostic
So yeah, we really do want the PTSD assessment for this.
criteria yet or not.
I'm not 100% sure, but for one, I wanna just bring up that she does have a history of self-harm.
Mhm.
And so that absolutely would necessitate a suicide screening, just for that, and then.
Wow, so you're actually going to be able to do a suicide screening. Amazing.
Regarding what you said about PTSD in her case notes, it said that there were, she did feel very unsafe in her neighborhood, and that I believe a couple of her friends had been robbed at knife point, or it was either knife point or gunpoint. But they were robbed with weapons in her neighborhood. And so that definitely in itself, along with, all of the other issues with her mother's domestic abuse towards her and her boyfriend's domestic abuse towards her mother. Those things definitely could lean into that. So like a PTSD screening would be, I think, really informative for us here.
Yeah, because we know she's been through a lot of trauma. We just don't necessarily know how she's dealing with it. We know she's kind of got some postpartum depression symptoms, but aside from that, we don't know if she's having any like flashbacks or nightmares or anything.
That's true. No, that's such a good point. I like the way you worded that we know that she has all of this trauma, but we don't know how she's dealing with it.
Mhm.
That's something we really need to know.
Yeah.
So I know we've covered a lot with our questions. So why don't we move on to her ACE score and talk about what kind of scoring we're seeing her at.
Also, I want to note that this is not the standard ACE survey, because the standard ACE survey only has 10 questions. So I believe what we're working with is the Philadelphia ACE survey, which adds 5 more questions, which I think personally are really important.
How about that observation?
About like the environment that one grew up in and feeling safe, because I think the original ACE survey kind of like neglected some of those areas that could be traumatizing.
Yeah, absolutely. Yeah, I did look at the was ACEs aware that screening. But I do understand, yeah, that we have this other one, that has 5 added questions. So why don't we go through the 15 question one, just since that's part of the caseload.
Okay, so the first one, did a parent, step-parent, or other adult in your household often or very often swear at you, insult you, put you down, humiliate you, or act in ways that made you afraid that you might be physically hurt?
That's definitely a yes for her. She indicated that her mother definitely verbally and physically is.
Okay, so what they're doing is they're talking about how they arrived at the score. They're not just saying, check, got a point, experienced this. They're going over how she experienced this. So adding background to each question. Does she fit? How does she fit? What happened?
Fault of her, and it sounded like her mother's boyfriend also made her feel very unsafe.
Yeah, I didn't indicate that he laid hands on her, but it's still an unsafe feeling when you know that your parent is in danger and you don't know, what's gonna happen to you next.
Exactly.
Did a parent, step-parent, or other adult in your household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? That's also a yes.
She indicated, bruises and marks on her legs from where her mother would hit her with the thumbs.
Okay, did an adult or person at least 5 years older than you ever touch or fondle you? Or have you touched their body in a sexual way or attempt to have any type of intercourse with you? I don't think she reported that.
I believe the case notes say she specifically denied that.
Okay.
And that's for her entire life, not even necessarily like in young childhood, that was just for her entire life. She indicated she did not experience that.
Okay, so number 4, did you often or very often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other?
So they go in great detail in that discussion for that. We're going to move forward a little bit.
Think I read in one of the resources that there people with the amount of ACEs that she has have an average of up to 20 years earlier death than like people who don't, which is wild.
It
And
is.
also, no, go ahead.
No, I was just gonna say, it just really goes to show you the severe impact that stress. Oh, it actually says right here, people, even people with less than 4 ACEs, which absolutely is not Simone, but
So in their paper, they did bullet points and just listed the impacts. And I might have responded to that, put in narrative form. But they did such a good job in the video explaining it and going into detail. Now, next paper, they could go into narrative form if they want to use bullets again, brief narratives. But for everybody's paper, if I watch the video and it was discussed better in the video and maybe short in the paper, I still counted it.
even those people have increased risk for health harming behaviors like underage sex, unplanned teenage pregnancy, which we already see is definitely something that she's experienced.
Through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. A number of factors contribute to how well people adapt to adversities. Predominant among them are A, the ways in which individuals view and engage with the world, B, the availability and quality of social resources, and C, specific coping strategies.
Yeah.
It's also directly linked to like the amount of protective factors that you have as well.
Absolutely. I like to think about resilience as in layman's terms, I like to think about like a rubber band. I don't know if I have a rubber band I can do a demonstration with. Oh, I do, look at that. So, like rubber band, if you've got like high resiliency, you're gonna get stressed and stretched out, and then it snaps back into its original shape. But low resiliency is gonna be more like a ribbon where you're kind of just stretched to your limit. It's not gonna bounce back. You're just kind of like there. And so it's like that ability to kind of internally get yourself restored to that level of homeostasis. Just I like your very clinical definition, but I always like to bring in a little bit more like
That was just a nice creative example of resiliency. And they both had one. I just showed you the rubber band one. Yeah.
living words as well.
Yeah, for sure. Okay, so what sources of resilience did she identify during her youth and currently? She actually identified quite a few, which
Let's watch the ending.
They do the same thing with suicidal ideation and anxiety and depression screenings in PCP offices. I've personally had a lot of those screenings, and it's if you score a certain amount, they say, okay, do you have a healthcare provider or a mental health care provider? If not, how can we get you one because you need something?
yeah.
So if it was used all the same way, I would feel less concerned about it.
Yeah, I agree with you. I don't think it should be like, oh, we have all the answers we need, like we don't need to, consult anyone else. Like I think it is it's more of like giving you a direction to go in for like, do they need more services? Do they need referrals? Yeah.
Okay, so in closing this case discussion, we're just gonna summarize some of the things that we kind of are taking as action steps to go forward. So we've already covered a lot of these things, what kinds of referrals or interventions, actions that we're gonna do for her. First, we think that Simone is a really good candidate for a trauma-informed art therapy. So that would be a referral that we would make for somebody that has that trauma-informed background. Obviously, we still need to know what her diagnostic criteria would be for PTSD. But even still, given her high ACEs score, we think that that would still be appropriate. We also talked about a lot of community resources that might help her in the meantime, things like affordable housing, support for her children's daycare and preschool costs. There are some resources she might have access to there as well. In addition to some just general bonding things that her and her children can do just to make sure that her children stay in a positive state of mind and build that positive relationship. And then finally, we think that it might be worthwhile for her and her PCP to have a discussion about some physical health screenings, things like cardiovascular risk, her family history of diabetes, substance use disorders. She could be at higher risk for those based on her family history and her high ACEs score. So having a conversation with her doctor about where her health currently stands and if there's any screenings that she might need to do at the time. Did you have any other thoughts?
I was gonna say potentially like family therapy referral, if that's something that, she feels would be doable. I know the kids are quite young, but, I think we mentioned, family art therapy potentially being,
Yeah, her
great.
4-month-old is a bit young for that right now, but her 3-year-old I think is at a great age to do something like that with her mom.
And then also with the community resources, making sure that she feels like she has good social support, outside of the home, but all, maybe discussing with her, like her family situation, and if there's any like in-home support that she could get more of, like, depending on like what the relationship is like with her sister, maybe that can be something that, she leans on a little more.
Absolutely. I mean, like we said already, there's a lot of unanswered questions we still have. So at the moment, these are kind of the things that we would pursue, but obviously I think first thing we really need to do is sit down and ask for a lot more questions and do a full therapeutic intake and figure out where she is, how she feels like she's really coping with things. A little bit more of a subjective analysis of her life rather than this fairly objective statistical approach that has been kind of taken so far with this.
Yeah, for sure.
All right. So I think that really shows 3 totally different ways to go about this. And they were all good. And as you know, if you got a grade, you did well too. Just because I picked those 3 doesn't mean yours wasn't just as good. So everybody did well. And if you needed to change something small, and if anybody did have to change anything, it was pretty small. All the videos were good. You might have to tweak a couple things, add a couple things, whatever. But yeah, I think everybody did a great job on this. And I'd like to share a couple, each of each project, so you can see what each other does. I just think it's interesting to share, each other, see what each other did. But any comments on any of them? Any questions?
Well, thank you for sharing that because that was like initially one of our questions, like with my partner, like how to go in the formatting, like if there was like any formatting for the paper. So that discussion we had at the beginning, but like not having formatting as well is helpful. Although like some people would rather have more instruction, but it's helpful because it allows us to be more creative as well. So
Yeah.
thank you for showing
I'm
like the
pretty open
variety.
about that, and if you hand something in and it needs a little more you can always fix it and get full credit, you know. But I do
Yes.
like to see all the creativity for sure.
Mhm. Thank you.
Yeah. Anything else? All right, have fun finishing up the suicide assignment. And there's a lot to watch online as well. So we'll see you later.